All right, well, let's jump into some segments. Rihanna, who actually I'm a really big fan of. I really want to see Rihanna live. I've never seen her perform.
Yeah.
Was in the news this past week. Did you see it?
No.
You guys? Oh, I figured you would have seen it. It was like the last couple days ago. So she went on Interview Magazine.
Okay.
Are you familiar with Interview Magazine? I wasn't either. Apparently, it's a pretty well-known publication. And she was being interviewed by somebody that was an old friend of hers, and she kind of opened up about her plastic surgery wants. So we're going to talk about plastic surgery that Rihanna wants, and it kind of ties into a segment that's breast lift versus breast implants.
Okay.
Because this is what Rihanna said. So she was talking about plastic surgery. She said, I want my boobs pinned back to my shoulders right where they used to be.
Oh, yeah, I saw that.
Yeah, I don't want implants, I just want a lift. And, you know, she's had 2 kids. Her kids are pretty young. I think they're like 1 and 2 or somewhere in that ballpark. And so, you know, I mean, Rihanna is just like, you know, any other woman. I mean, yes, she's a superstar, but I mean, just like any other woman who's had kids, you know, she's basically making commentary about how her body has changed with pregnancy. And I really like the thing that she said about, I don't want implants, I just want to lift, because that's really educated thing to say that a lot of people don't know that. And so I wanted to dig into that a little bit. And she talked about some other things. She's like, well, you know, I kind of thought about a tummy tuck, but I don't want to go through that big surgery. And she's like, BBL, not really. I can just work out.
Yeah,
so really,
I feel like she already has the goods for that.
Yeah, she's like good to go. But no, she wants a breast lift, and that's super common for women to want to improve the shape of their breast after pregnancy. And so the big question is, you know, how do you restore your pre-pregnancy breast? Or sometimes people will say, I want my pregnancy breast.
Okay.
And so, you know, for the person that's not very well educated in plastic surgery, a lot of them really feel like, oh, I have to get implants, I have to get implants. And I do think, unfortunately, there are a lot of women who, you know, they get that idea in their heads, like, I want to restore the fullness I had, I need implants, and they go to a surgeon and they say, I want implants, and they don't take the time to really dig into, is that really what they want? Yeah, I mean, and that happens to me all the time where we get consults for things and the person comes in wanting something, and then when I start to talk to them, I figure out, okay, they just want a result, but they don't know how to get it. And this is kind of one of those, I think, classic cases of that. You know, as you know, pregnancy affects breast size, shape, and position, or it can. It doesn't always. I mean, some people are just naturally genetically less predisposed to have those changes.
Right.
You know, a lot of it weighs down to how much weight people gain and lose in pregnancy and how fast they gain it. You know, do they have a history of sun exposure where their skin's more vulnerable to stretching and all that?
Yeah, that makes sense.
But getting the right surgery kind of depends on, you know, what your starting point is and what your goals are. And so you can kind of like think about implants and lifts as doing some of the same stuff, but also different stuff. So the way I would describe implants is and this is for people who have had kids specifically.
Okay.
I mean, they restore volume and they restore fullness. And that's basically what they do. A breast lift can restore volume and fullness if they have the breast tissue, but it also reshapes the breast.
Okay.
And so, you know, it's like, okay, well, great, thanks for telling me that. How do I know, you know, what I want? And ideally, like if you go and you have a consult, you know, with a plastic surgeon, they should go over all this stuff with you. But I mean, everybody runs their practices different, and sometimes, you know, you go in and you end up talking to the nurse about it, and they may not go as much detail. Have you had that experience where you went to I know you've been to plastic surgeon before, you've been open about it, so I'm not that I saw it, but when you went there, like, was it like the nurse that went over the stuff with you, or?
I'm sure she did, but I mostly remember just talking to the doctor.
Okay, so the doctor took the time, and you feel like they explained everything to you? Good.
Yeah.
That's great. I mean, that's the way it should be. I mean, if you're going to go through surgery, you know, you really want that person that's the expert explaining it to you. So I guess, you know, one of the ways you kind of figure out, do I want implants or do I want to lift, is, you know, you ask yourself this question: are you happy with the shape of your breast after pregnancy? You know, and if the answer is no, then implants are probably not the right answer for you, because the implants don't really affect the shape to any significant degree. They restore fullness, you know, and they restore volume, but it doesn't make a huge change to the shape. I mean, to be 100% accurate, it makes a slight difference to the shape, but mostly it's about the volume. And then the next question you ask is, are you happy with the size of your breast? And when you ask yourself that about the size, it can be hard for people who have significant, sag to their breasts after pregnancy to really know, okay, how much volume do they have? So like when I'm measuring volume, like I'll actually take the breast and set it up where it belongs. Say, okay, if your breast was lifted like this and it was, this big, are you happy with that size? And that's kind of how I dig into, what exactly is the patient wanting to get? Because it doesn't matter what procedure they get as long as they get the result they want. But so many women, will go in to a plastic surgeon and they come out and they don't get what they want. I mean, you guys have had friends that have ever had that happen to them where they went in to get plastic surgery and they come out and they said, I didn't get what I want?
Well, I mean, I think I sent one of my friends to you.
Yeah,
that happened too.
Yeah.
But yeah.
So so the answer for you is for sure, yeah. Do you ever see that trouble? I guess, I don't know, people may not be as open to you being a guy about plastic surgery.
Yeah, facts. No, I've not run into that issue.
Yeah.
I've not run into that one.
I mean, for me, it's like people always want to talk about plastic surgery. I mean, so I hear these stuff even as a guy, but I can understand. And then, as far as the other question I ask is the fullness of your breast. Like, if you're just wanting to restore fullness, I mean, you could potentially go either route if you have the volume of breast tissue. If you have the volume and it's just not in the right place, then all you really need to do is a lift. And I do a lot of lifts where I feel like they look like I have implants, and I almost never do this, but I brought some pictures of some of the stuff that I've done, and we're gonna take a look.
Have you ever done lift and implant?
Yes, and so that's the other thing, and that's a great question. Yes, you do that.
Okay.
That's for somebody, and I'll go through it. So there's 3 ways you can go. You can do implants, you can do lift, and you can do a lift and implants, as you said. So the person who would go after a lift and implants is somebody who, number one, doesn't like the shape of their breast because there's too much hang to it or too much sagging, and number 2, their breasts are too small. And so that's where you would say, okay, we're all in one surgery, we're gonna lift the breasts up, we're gonna make the shape nice, and then we're gonna put an implant in there to kind of make the volume be what you want. And so you can totally do that. It's always